guys, it's HINA Chef here at Rebalance Physical Therapy and Wellness in Center City, Philadelphia, as well as in Narberth, Pennsylvania. And we are a group of holistic, hands-on physical therapists that treat the whole body, and we specialize in treating conditions related around the hip, abdomen, pelvis, and low back, and everything kind of in between, as well as above and below that, but that's what we kind of really specialize in and what we're known for. And today I want to talk to any of you out there, men and women, who have basically developed either lower abdominal pain that feels like a hernia, or any type of pelvic pain, perineal, genitalia discomfort and pain after having an extended period of gastrointestinal issues. So whether that was a long-term infection that has basically been going on with your gastrointestinal system, stomach infections, bad bacterial infections, any sort of long-standing IBS, bloating, SIBO, basically anything that you can think of that involves the intestinal system, that then possibly all of those GI symptoms have improved according to your physician, but now you're kind of stuck with this abdominal pain, this genital pain, pelvic pain, that you rectal pain, that you don't understand why that's continuing to go on. You've seen your urologist, possibly you might be even having urinary symptoms such as frequency. You're not feeling like you can completely empty your bladder, or all of these things going on. You've seen your urologist, they don't really know what's going on. They've possibly put you on some antibiotics, but that didn't really take care of things, or maybe it did temporarily, but now it's back. You've seen your GI physician and they're like, well, everything looks good from our perspective. You've seen your colorectal, they kind of don't know really what's going on, and most likely there's nothing really going on colorectally, I can already tell you that. But you're continuing to have this pain. So what can it be? Well, this is something that I actually have seen very commonly. My grammar is off in this video, but it's very common to see this condition following any type of GI issue. At our clinic, we actually see a lot of these diagnoses and symptoms that actually kind of come together as a package, okay? And then we're trying to pull back the pieces and figure out basically what's going on. But for any of you, if you're kind of resonating with this video, which I know many of you probably are, this is most likely a musculoskeletal condition that involves the pelvic floor musculature. Okay, so what do I mean by that? So basically, anytime you have any type of infection, usually with a chronic infection. So what do I mean by chronic? Chronic means probably around a couple of months. So usually chronic in medical terms means at least 3 months. So about 3 months or longer. What can happen is that the brain can actually change, as well as the organs, because of the way the nerves from organs run up to the brain, okay, and then the brain interprets nerves back down. They can form basically what's called crosstalk, okay, where, the nerves are kind of like highways, okay, lots of different highways, and there's cars going up and down these highways. So we're gonna use the example as cars being the signals that go up and down from organs and muscles and up to the brain and back down to the brain for communication. Well, you can get traffic jams and you can get cars going in the wrong direction, and no one's paying attention to the signals. And so they can get crossed. And when that happens, you can end up having muscle issues in and around the vicinity of those organs, okay? So this is equivalent to someone who's having a heart attack and they end up having symptoms down their arm, okay? That's very typical of a heart attack. Even though it's not your arm that's actually having symptoms, it's your heart that's the problem. But because of the way the signals are, it can actually, when the brain is interpreting, hey, there's something going on with the heart, and it sends signals down, it can cross into the arms. And so, say if this was going on for a long period of time, which in the case of a heart attack, it's a very acute condition, so usually it's taken care of right away. But say if it could go on for a long period of time, you would actually have physical changes to your arm, or you could. Okay, so that's the same thing that happens with other organs in your body. When the stomach or the intestinal system is kind of going haywire and inflamed and not functioning properly, and there's pain going on in there, well, the muscles and the fascia in and around those organs, as well as around the abdomen, the genitals, the pelvic floor, which are a group of muscles that are pretty, they basically hug around some of these organs, can start to become tight and painful. And so even though you've taken care of the intestinal issue or the stomach issue or whatever organ-related issue it is, in this case we're talking about a gastrointestinal, then even though that's taken care of, it's not like the muscles around those areas and the fascia around those areas just automatically disappear. They can actually stay around for a long time, if not years. So basically what can be done? So if that is what's going on, and now that muscle and that fascia is actually what's causing a lot of your pain, including some of the nerves that might be involved and run through this fascia musculature, well, then that's actually what the culprit of your pain is now. It's not really the infection anymore. And so you actually have to have that treated. So you need to have all of that musculature, all of that fascia that surrounds all of those organs worked on and improved, and so that your body can get back to functioning the way that it should. Because that's basically going to disrupt, if you can imagine, muscles that are tight, muscles that are painful, fascia that is tight and painful. And for those of you who don't understand what fascia is or what trigger points are, which I'm going to talk about in a second, I have lots of other YouTube links that you should be able to listen to that explain what is fascia and what is trigger points. So anyway, these tight muscles, tight fascia, can form trigger points. And trigger points are areas of pain that can give you localized pain, or it can refer pain into other areas and other muscles of the body. So basically when that's going on, that muscle is no longer functioning optimally, and so that can disturb the way you sit, the way you stand, the way you lift, the way you get into a car, the way you play sports, all of these sort of things, okay? And we see this we see this every single day in our clinic. I would say about 90% of our patients that are coming in usually have some sort of this stuff going on. And then there's various techniques that we use to really soften, improve the mobility of that fascia, as well as the musculature, and then incorporate a lot of different movements and stretches, as well as strengthening and stability to really get your body functioning the way that it should. So basically, if you think you have this going on and you live in and around the Philadelphia area, as well as the surrounding suburbs, we actually see lots of patients that come from far away to see us. But if you think this is what's going on, and this is resonating with you, this is probably what's going on. So I would say don't think this is going to necessarily go away on its own. It really does need to have treatment to it in order for it to improve. And we're here for you. So if you feel like this is going on and you want to come in for treatment, you may qualify actually to have a free consult with us. So hop onto our website. It's www.rebalancept.com. That's REBALANCEPT.com. And if you don't live in and around this area, we have lots of other YouTube videos that might be helpful to understanding what this condition is. And you probably need to look for someone similar to us in your area that really understands how to work on this holistically, understands how to work on fascia and musculature as well as the pelvic floor, and kind of combine this together. So you want to look for someone that does specific pelvic floor physical therapy work and that knows how to incorporate a lot of this in together. So I hope this video was helpful for some of you guys, and have a wonderful day. Take care.